These 12 pairs of cranial nerves, we take 1 and 2 together, 3, 4, 6 together, 3, 4, 6, 7, 1, 5 and 7 together, 8, 1 class, 9, 10, 11, 12, 1 class. So how many classes? 5 classes. And with revision, because in 1 class 3, 4, 6 is difficult, so 3, 4, 6 may be 2 classes. And if we want, we can do it all the 12 cranial nerves in 1 class. There is no hard and fast rule by NMC. It can be done. But it is almost impossible for beginners to catch like that. Very, very difficult at least. Very difficult. So we do 1 and 2. So Monday's class was for these 50 students who should be there today. How many are there? Not 50. So 30 maybe. 30, 35. So this is class 1 cranial nerve 1 and 2. Now again HOD sir, this is a bit tougher part, has broken the sequence, usual sequence. There is no hard and fast rule again. They can higher functions, after that in the syllabus it is comprehensive also written, after that sensory system, after that motor system, reflexive, then cranial nerves. Usually doing that way, but sir has started cranial nerves after higher functions. So sensory system, examination of sensory system is examination of general senses, which you will do theory. There is a separate topic. Examination of that is called somatosensory. Somatosensory, general senses, touch, pressure, vibration, pain, temperature. Okay. What are the general senses? And cranial nerves are dealing with the special senses. Vision, audition, olfaction, gustation. Vision, cranial nerves 2 and 3, 4, 6. Olfaction, cranial nerve 1. Audition, cranial nerve 8. And gustation, this is cranial nerve 7 and 9. Now those who attended the class on Monday, except those 4, everybody attended on Monday, or somebody was there sleeping at the hostel or at home doing something else. They have learned to measure BP. So somebody already has a chamber outside measuring pulse and blood pressure of patients and writing some medicines. So I was absent on Monday for that reason. Is somebody there like that? Otherwise maybe sleeping at the hostel, roaming around, did not feel like seeing a movie. Everything is allowed, but you have to, that be allowed means nothing is illegal. 75% attendance is the rule. Nothing is illegal, but you have to pay for that if you are not sincere. So name the cranial nerves. Cranial nerve 1 is, I don't know whether it will write or not. It is writing till now. Name it one by one. 1 is olfactory. 2 is, so one person should not say everything. There are people during the exam who cannot even name any of the cranial nerves during this first talk, which you are supposed to learn in say standard 9 or standard 11 maximum, at least after completing the secondary exam or before that. So 2 is optic. So 1 is olfactory, 2 is optic. Naming the cranial nerves don't require that you attended on Monday or not. The cranial nerve 3 is, only one person answer. Whoever is 3 is, again loudly, don't, others don't say. 3 is ocular. No, that is not the name. 3 is oculomotor. 4 is trochlear. Again, I am asking one person answer and make it a habit. During the exam, Viva, if you do this, there will be a very bad impression. Viva depends on, depends, at least some part depends on what impression it is creating in the mind of the examiner. Don't prompt when you are not asked to. 5 is, and you cranial nerves, you practice writing like this whenever you write. Say CN3. CN3 is oculomotor. Write like this. CN capital. If you can write total cranial nerve number 3, it is better. If you try to use abbreviation, write CN3. And not, I should have written it in red, red is not there. Not this. This is the, C3 is the name of a vertebra, cervical vertebra 3. This is how to write a cranial nerve. Remember this. Don't write C3, C4, C5, C12. How many cervical vertebrae are there? So C12 will not be there. You can write up to C8. So C8 means 8th cervical vertebra. 8 to cervical 8 to 7. So see, nerve root 7, vertebra 7. So C7, C4. Don't write C4. C4 is 4th cervical. C4 অনেক সময় বা যদি নার্ভ রুট কেও বোঝায়, that is C4. For cranial nerve, write CN 3, 4 and in Roman. Practice this whenever you write. And best is write the name of the nerve. এখানে OSPI থাকবে. OSPI will be there. Question will be one picture of a test is given. So those who have attended the class on Monday, one person is looking at the sentence chart. So which cranial nerve is being tested? In the OSPI answer you write cranial nerve. Best is to write whole word, only 3-4 words. Cranial nerve 2 you will be given 30 seconds. It is possible to write in 30 seconds. Take 15 seconds. Cranial nerve 2 dash optic nerve. Best answer is this. If you are answering, if you answer like this CN2, then also usually you consider, but write CN and 2 in Roman, not C2. If you write C2, you will not get marks. CN2. Best is to write cranial nerve 2 or CN2 dash optic nerve. Write like that. Now 6 is seventh is facial. Eighth is who said auditory? You. So answer is wrong. Answer is partially correct, auditory, but it is an answer like pulse rate is what is the normal pulse rate? 72 per minute. This is an answer from the 3rd standard. Normal pulse rate is 60 to 100 beats per minute. So 8th nerve is vestibulocochlear. Cochlear is the auditory and vestibulo part is concerned with balance and all. Vestibular apparatus. So you have to write vestibulocochlear, not auditory. That is from school level answer. So it is this is one part, this is one part. 9th is Glossopharyngeal. Blossom, the tongue, blossom relates to the tongue. 10th is blossom relates to the tongue and pharyngeal pharynx. 11th accessory. Sometimes we call it spinal accessory because cranial nerve, but I always prefer writing accessory. It is cranial accessory. Accessory nerves has 2 parts, cranial parts and spinal part. So here we are probably dealing, probably not, we are dealing with the cranial part. We will say just accessory. There is the spinal accessory and cranial accessory together. They are supplying, so 2 muscles we test for that. When we do it, we will learn sternocleidomastoid and trapezius. 12 is hypoglossal. So under the tongue, hypoglossal related to the tongue. Okay. Now what will be the types of these nerves? Types means according to the functional types. Either it may be sensory or maybe motor, or maybe both sensory and motor, and they are called mixed nerves. So this is related to olfaction and it is a pure sensory nerve. This is related to vision and it is a pure sensory nerve. So for sensation, what are the special senses? Special senses dealt with by these nerves. What are the special senses dealt with by this cranial nerve? Special senses are dealt with by cranial nerves, and general senses are dealt with by some part by cranial nerve, like sensation of the face by one cranial nerve, but sensation of other parts of the body by peripheral nerves. So those are general senses. What are the general senses? Touch, pressure, vibration, pain, temperature. Touch, pressure, vibration. Am I missing out anything? Touch, pressure, vibration, pain, temperature. Touch, pressure, pressure and vibration comes in the same way. Pain, temperature. Okay. And special senses are seeing, vision, audition, olfaction and gustation. Taste is gustation. So olfaction will be taken care of by cranial nerve 1, vision by cranial nerve 2, the sensory part of vision by cranial nerve 2, but things related to vision also by 3, 4, 6. Okay. So 3, 4, 6 are in books. Now I tell you again, I'll repeat again next week I think. 3, 4, 6 in the book I am always recommending. That book it is given as mixed nerve. That book it is given 3, 4, 6 are mixed nerve. But you consult textbooks of, standard textbooks of physiology, nobody is telling that sensory part of vision is related to 3, 4, 6. Only some motor activities. So extraocular muscles mostly, and some muscles like ciliary muscle and all. The extraocular muscles we will name them next week, and ciliary muscles and all, and these are supplied by 3, 4, 6. So 3, 4, 6 has do only supply of muscles. Okay, supply of muscles and motor function. So these are not mixed nerves. M is for motor, not mixed. Okay. So these three we read in study in as a single topic. 3, 4, 6 they are motor nerves. So although I am recommending the book myself, you may read any book again, but to me it appears that it is better for the beginners. So that book it is writing 3, 4, 6 as mixed nerve, but 3, 4, 6 are not mixed nerve. It is motor nerves. So like 3, 4, 6 is motor nerve. Okay. Okay. We write the sensory nerves. This is sensory. So although it is controlling the vestibular apparatus, 1, 2 and 8 are sensory. Although it is something to do with the vestibular apparatus, but it has to do with the sensory part. What sense is that? That is proprioception, which will be when you study the somatosensory system class, CNS theory class will be taking place. So in my opinion, it would be better if the theory class had been taken earlier. But proprioception is the, have you heard the term before? Proprioception is the joint sense, positioning sense in air. Like even after closing the eyes, if my hand is passively raised, this is active movement. I am myself raising the hand. Even if some other person raises my hand, so I feel the touch. That is touch sensation. And that but even a blind person, even though my eyes are closed, or even who is blind earlier, can tell that my hand is in this position in the air. It is above on the right side above the head, or it is near the ear, or it is near the nose, or it is near my pockets of my trousers. Near, not touching but near. So that position can be determined even without using the visual and auditory cues. Other sensation, any special sense. So that sense is called proprioception, and proprioception is that sense which is taken care of during the vestibular apparatus body balance. That is the sense which is working So 8th nerve, and other than that, obviously cochlear part is taking care of audition part. So 8th nerve is sensory nerve. 8th nerve is, although vestibular apparatus you may think, if you have a general idea, or not done in the theory classes, even general idea, body balance and all, but only sensory things are being taken care of by the vestibular nerve. So 1, 2 and 8 are sensory nerves. 3, 4, 6 are obviously, not obviously, 3, 4, 6 are, remember, no sensory part of vision is associated with this. It is motor nerves. Okay, motor nerves, trigeminal, facial, glossopharyngeal, Vegas mixed, and 3 হয়ে গেছে 3, 11 and 12 are motor. Hypoglossal supplies nerves related to the tongue movements, no sensory action. Accessory, sternocleidomastoid and trapezius muscles you have heard by now. Trapezius, neck, head, neck, brain to হয়নি এখনো, হয়েছে, thorax, abdomen চলছে, head, neck, brain, head, neck, brain done, started, I mean not done, started, not yet started. But I think you have heard these names of these muscles, sternocleidomastoid, thorax. আমরাই বলেছি কোথায় sternocleidomastoid, কোথায় বললাম, during the movement, when it becomes prominent during the respiratory system. We have uttered trachea position of the trachea দেখার সময়, this is one head. I think I made one mistake, anterior and posterior head বোধহয় বলে না, I uttered those terms, এখন আর বলে না, একজন অ্যানাটমি তোমাদের ফ্যাকাল্টির সাথে করলাম, স্টার্নাল হেড আর ক্লাভিকুলার হেড বলে, স্টার্নাল হেড আর ক্লাভিকুলার হেড এরকম ভাবে বোধহয় বলে. So this prominence, সেখানে trachea দেখতে হয়, tracheal positioning. So there we have mentioned about sternocleidomastoid. You turn the head to one side, other side it is becoming, one head is becoming prominent. So that is probably the clavicular head. Again check with your anatomy faculties. So not anterior and posterior. আমি বলেছিলাম এটাকে anterior বলে আর পেছনেরটাকে posterior বলে. In fact when we learned, okay, if I am making a mistake, so teachers and books are complementary. So teachers are human beings, sometimes they make mistakes. I think nowadays it is called categorically sternal and clavicular head. So sternal and clavicular head, so this head which is becoming prominent on turning the head to other side. So we mentioned sternocleidomastoid at that time, and trapezius, sternocleidomastoid we have to again study, in physiology we have to mention during accessory. Nerve, hypoglossal nerve is motor nerve. So 5 nerves are motor nerves, 3 are sensory, 3 plus 5, 8. So 4 are mixed nerves. So mixed, we are writing as, instead of writing M, it will be better to write, either you write mixed, the total word, or you write is sensory plus motor. So this is sensory plus motor, trigeminal, this is sensory plus motor, this is sensory plus motor, Vegas is sensory plus motor, and we will do the details when we teach the nerves. Glossopharyngeal and facial, you remember facial carries taste sensation from the anterior 2/3 of the tongue, and the branch of the facial nerve which is dealing with this is called the chorda tympani, CHORDA-TYMPANI. So on Monday, many were present. Who are present? How many? So on Monday, only the cranial nerve 1 and 2 were discussed, or all this introduction was discussed? Only 1 and 2. So I think before starting 1 and 2, we should do this to have an idea how many are 3, how many are sensory, how many are motor, and how many are mixed. So say motor I have written as S plus M, because if I write only M, it will not do, because M for motor, mixed I have written as S plus M. So that is trigeminal. Now why trigeminal sensory function is what? Carrying the general sensations, not any special sensation. What are the general sensations? Touch, pressure, pain, temperature, vibration. Touch, pressure, vibration, pain, temperature. Like that. So touch, pressure, vibration, pain, temperature carried by the general sensations from the face, trigeminal nerve. General sensations from the face. Sensory, facial and glossopharyngeal are carrying taste sensations, that is one special sensation. That is from the tongue, anterior 2/3 of the tongue, chorda tympani branch of the facial nerve, we will read in anatomy also. So cranial nerves is usually anatomy class. This is going side by side. Head neck brain not started there. So in my opinion, this topic should have been done a little bit after say 1 month or so. You would have started it in anatomy. Courses of cranial facial nerve course. Even I am not an anatomy faculty, but I can completely remember from my facial nerve course, tortuous course, not a straight course, tortuous course, very important question in anatomy, if they have not changed the syllabus. So you check your anatomy syllabus and with your anatomy teachers, facial nerve course is very important. Like in the arm, radial nerve, or radial artery, like that. Facial nerve course, even I think they will not ask in the physiology exam like that. But some tits and bits will be asked even in the facial exam. And if you see from your anatomy book, when you read the topic facial nerve, see the course and you will find where branches is going out. Chorda tympani branch is going out, and when you read it together, you will save some time, I think, and you will revise both the subjects. So when you read facial nerve, you read the anatomy and physiology together. That is my opinion. Okay. So facial nerve course is important in anatomy, and facial nerve, what is the sensory part? Motor parts, it supplies almost all of the facial muscles except 1 or 2. We mentioned that when you do it, but almost all of the facial muscles, and sensory part, it is carrying a special sense, that is the taste sensation from the anterior 2/3 of the tongue. That is and which branch? Chorda tympani branch of the facial nerve. Now who is carrying the taste sensation from the posterior 1/3 of the tongue? That is another we have mentioned, glossopharyngeal. Trigeminal nerve carries general sensation from the face. General senses, touch, pressure, pain, temperature, vibration. It is ultimately related to the thalamus. So pain, temperature from the, we are deviating from today's topic actually. Pain, temperature from peripheral part of the, this means say pain from the leg. Carried by which tract? Pain, temperature from the legs, arms. Carried by which is what is the name of the tract? Now we will deviate if we go like this. Tract means white fibers. Ganglion. What is ganglion? What is ganglion? Ganglion is a collection of nerve cell bodies outside the central nervous system. Nucleus is a collection of nerve cell bodies. This is not the nucleus of the cell. This is not the cellular nucleus. Nucleus in nervous system is the collection of cell bodies within the central nervous system. So cranial nerves are nuclei from which nerve fibers are arising. Cranial nerves are nuclei. And what are nuclei? What is nucleus? Nucleus is collection of cell bodies within the central nervous system. So these will be discussed in anatomy classes also, I think. Nucleus is the collection of cell bodies. Cell bodies are collected in one place, and the fibers, dendrites are coming, axons are going out. Structure of neuron, dendrite or dendron, cell body, axon. So fibers are dispersed from the cell bodies, and the cell bodies are multiple cell bodies collected at one place. If it is within the central nervous system, it is called nucleus. This is different from the cellular nucleus. Nucleus of the cell, RBC has no nucleus, WBC has no nucleus. That is the cellular nucleus. This is the nucleus related to the nervous system. Same term, so don't confuse. So nucleus in nervous system is collection of cell bodies within the central nervous system. Ganglion, plural is ganglia, G-A-N-G-L-I-A. Ganglion, just write these terms, don't write the definition. These terms you will get related to the nervous system. Nucleus, plural is nuclei. So there is no more space. Nucleus, plural is nuclei. I think you know the spellings. Ganglion, plural is ganglia. Nucleus, collection of cell bodies within the CNS, brain and spinal cord, and CNS is brain and spinal cord. Ganglia, collection of cell bodies outside the central nervous system. That is plural. If it is singular, ganglion. And another type of ganglion in reading surgery. Forget it now. That is one type of swelling and all. That is another. So there are so many similar terms. Okay, like in English, there are so many terms, so many words which have the same meaning like that. During nomenclature of human bodies, there is a name. So, how many are interested in films? Films. Hindi films, Bengali films, English films. So, what are you doing at home? Work? Walks. Okay, you are ill. Right. That is excusable, but in these cases, you just apply to the student section. Did you do it? I don't know. You ask the Dean sir or An sir whether the attendance will be excused. I don't know the rules now. Because one person was ill. In the 22 batch, one girl was ill for 2 months or so. But she had to attend after the before the prof, extra attendance, she had to attend extra classes. I mean, no one was taking the class, just sitting at the lecture theatre and marking the attendance for so many hours. So be acquainted with these rules, otherwise if you don't get eligible, you have to appear after 1 year, not even after 3 months. Officially, if someone is not eligible, that I know. Because internal assessment marks are going after 3 months, no college will send separately internal assessment marks. That will be done again after 1 year with the fresh next batch. So due to attendance, if you miss any due to attendance or due to poor performance, that is marks you get less in the exam. If you miss, you won't get a chance after 3 months. Again, you have to appear with the next batch. Next batch, you have to attend class, make up the hours, make up the attendance, appear for the internals, and then you will be again allowed for the this exam. So you check that with the HR, that means office, student section, not office, not HR office, student section, and dean sir. Why are you talking among yourselves? Don't disturb the class. If you are feeling bored, please leave. So check that. As you told me you are ill, I just mentioned this. So for everybody, if you are absent due to medical reasons, still you have to maybe you have to make up the attendance according to the rules. Now, greater than 3 months, at least in MD courses, say sometimes it happens unfortunately, a person doing an MD in a pulmonary medicine gets affected. I knew one person in my days when I was a house staff in chest medicine. One of our senior brothers got ill. He catched tuberculosis from one or more of patients and absent for 6 months. I don't know what happened ultimately, but he was not allowed to sit for the exam in the first time. And in the PG you miss also. So many things you miss if you are absent for 6 months, 7 months, 8 months. Even after 6 months the person will feel weak. And it is not possible for him to attend everything so diligently. Very tough. So I think he had to appear for the exam which was called supplementary. Nowadays there is no term supplementary. After 3 or 4 months they had to attend. Not after 1 year but after 3 or 4 months. Something like this happened. So that guy is now very well established practicing in North Bengal. But this happened with him. He caught tuberculosis from one or more of the patients. And we should be using mask and all these precautions we take, even then, unfortunate. So like that, what is the rule if you are medically absent or something? What is the rules for attendance? You check with the student section. So movies, how many interested? So Kajol can be the name of both male and female. Okay. So same thing applies to the same word applies to different things. Kajol can be the name of both male and female. Same word has different meanings. Like that, nucleus, ganglion. Ganglion you will read in surgery. What is ganglion? What type of swelling is called a ganglion? What type of swelling is called a lipoma? Everything. Lipoma is single term, but ganglion in nervous system, anatomy, physiology, from the anatomy point of view, especially anatomy point of view, it's a collection of cell bodies outside the central nervous system. So cranial nerve will not have ganglia or ganglion. It will have nuclei, collection of cell bodies. Where the cranial nerve is located? In the brain stem, midbrain, pons, medulla oblongata. 4 we remember like this. You have to detail, you have to check again with the anatomy books and anatomy teachers. I think 4 in the midbrain, then pons, then medulla oblongata. These are the parts of the brainstem. These basics you know or remember, or you will read again in anatomy. Midbrain, pons, medulla are making up the brainstem. So all these cranial nerve nuclei are present in the brainstem on both sides, obviously bilaterally. 1, 2. So 1, 2, 3, 4, midbrain, 5, 6, 7, 8, pons part, and medulla oblongata 9, 10, 11, 12. This is what I can recall right now. And we have to, again, even I and also you, obviously you will have to write these things in the anatomy exam and mention these things, or brain dissection, whatever, structure, specimen. I think it is not possible in specimen to identify nerves, but cranial nerve nuclei, but whatever, you have to do it in anatomy and you have to write it in the exam and learn. So that is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 4, 4, 4, midbrain, pons, medulla, and together midbrain, pons, medulla, these are parts of the brainstem. So respiratory center in the pons. Oh, respiratory center theory is still not done. Theory just started. Introduction to the respiratory system was done yesterday. Those who attended. So midbrain, pons. So according to that 1, 2, 3, 4 like this. But forget it for now. It will be discussed in anatomy. Location of the cranial nerve nuclei. But that is called nuclei, not ganglia. So nucleus is collection of cell bodies within the central nervous system. Now from the nucleus, the nerve fibers are diverging. Not nucleus, nuclei, which will be plural, collection of cell bodies. So if there is single, then it is nucleus. So sensory taste is taken care of by facial, anterior 2/3 of the tongue, chorda tympani branch, and glossopharyngeal posterior 1/3 of the tongue. And what is vagus? Sensory motor, it is diverse. Vagus is related to the autonomic nervous system, heart. If the vagus nerve is motor part, if the vagus nerve is activated outside normalcy, then even the heart may stop. Like this, vagus. And what is sensory? Sensory supply from these internal structures. So vagus nerve. Vagus nerve is the longest cranial nerve, which is the shortest, I think, trochlear, as far as I remember. Trochlear cranial nerve. So all these will be dealing in anatomy when you read about the cranial nerves. Shortest course, I think, shortest course, trochlear, longest, MCQs in anatomy. And for NEET PG and all, even nowadays in NEET UG, because you have to eliminate, either ethically or unethically. What I was telling yesterday in the theory class also. Either ethically, if not possible ethically, unethically kick those out. Because you have to eliminate. By hook or crook, there are so many number of seats, and appearing is 5 times that, so 4/5 have to be, I say it like this, very bad to hear, kicked out, that means eliminated. So what is when we can't eliminate ethically, we eliminate unethically. So what shortest cranial nerve course, even in NEET UG if they give, nobody has the chance to, there is no structure where you can go. Only what they can do is all people then go there and sit on the roads and block the roads. This is our country. What is happening in this country? Unethical things, and to combat that, unethical things again. So is blocking the road or train line good? So somebody is blocking an ambulance good? But we are being dealt with unethically, so we are combating unethically. So this is how our country is running. Our country or most of the world. Especially developed countries like this. So if this is given in NEET UG, this is unethical. If it is given in NEET PG, it is ethical. Ethical, not legal. There is a difference between legal and ethical. Ethical is more, not difference, related. Why are legal issues there? Why is section 498 there? To save those newly married or married female ladies, whatever, if this was a culture that they are tortured by the in-laws. This was the idea at first. Now what is happening? This still carries on in different parts, especially maybe very remote rural areas. But some people are taking advantage of this, making false allegations. You know of these things in this area of Facebook and all social media, these things are coming out. So they are taking advantage of this. Laws against rape, sexual assault, these are again by making false allegations. People are taking advantage. So these are happening. So now the court has again, the legal system is again considering those things. So sometimes that in cases of sexual assault, the lady's word is even sexual assault can be on a male. And you will read these things in forensic. Sexual assault can be done on a male person also. These ideas are coming up now. So legal things are related to moral things. To abolish immoral, to reduce immoral activities, legalities, laws are made. But again, laws are taken advantage of. Wrong-minded people are taking advantage of certain laws made for those people. And so, again, the things are becoming complicated. You know this case from Arjigor Medical College, this incident, this rape and murder case. So what is happening? Discussions are going on that the person who is behind the bars now is being framed. Actually, it has been considered by some powerful nexus so these discussions are going on. So these have to be edited when they will send me this evening during the class. Otherwise, I will be kicked out, eliminated from Shantiniketan Medical College. So these have to be edited in the evening. I will myself edit and send again so that whatever will go to the social media. So you know all these things. So ethically, NEET PG question, that is ethical. Shortest cranial, because you are learning anatomy. But NEET IMG, I think it is unethical. We never read we know the names, but I don't think we read about the shortest and longest and what is everything. I don't know. If it is in the board syllabus in the schools, then it is ethical. But if it is not, then it is unethical. So that will be determined by that. Anyway, so these are the mixed. How many so are mixed nerves? 1, 2, 3, 4. 1, 2, 3, 4. So see the numbers of the mixed nerves. 5, 7, 9 and 10. Write this mixed cranial nerves. Write this CN5, CN7, CN9, CN10. It's already 12:30. So I'll have to teach cranial nerve 1 and 2 in 30 minutes. Even that will do. In 2 hours, we can do the 12 cranial nerves if you want. So cranial nerve 1 and 2 in 30 minutes. So mixed, you have written this line. Just write, and even before the exam, if you just turn the pages in say 15 minutes, some lines will help you. You have written mixed cranial nerves 5, 7, 9, 10. In bracket you write vitamin K dependent coagulation factors. We use Roman numericals 1 to 13 for coagulation factors. We use Roman numericals for coagulation factors. Yes, we use. One is fibrinogen or prothrombin. One and 2 are fibrinogen and prothrombin. So 1 is prothrombin, 2 is fibrinogen. Just now, at this moment, even I am confusing. I am getting confused. 1 is fibrinogen, 2 is prothrombin, or opposite. Whatever you write, just now I myself got confused. 3 is tissue thromboplastin, 4 is calcium, like this. 5 is pro-accelerating, 6 is absent now. 7 is 8 is anti-emetic vector, 7 is like this. 13 you have to memorize. So write 1 is fibrinogen, I think. 2 is prothrombin. Okay, we have to check that again. We'll check that. So teachers are human beings, but you have to memorize. During the exam, if I forget, there is no problem. If you forget, there is a problem. Write vitamin K dependent and write in Roman. coagulation factors we use Roman numericals. Coagulation factors we use Roman numericals. Right, vitamin K dependent coagulation factors 2, 7, 9, 10. 2, 7, 9, 10. And we have to check the names again. So here mixed cranial nerves are 5, 7, 9, 10 Roman numericals. Coagulation factors which are vitamin K dependent are 2, 7, 9, 10. Important for MCQs and ethical MCQs. 5, 7, 9, 10 are mixed cranial nerves in cranial nerves, and 2, 7, 9, 10 are vitamin K dependent coagulation factors. We will again go through the names. Today go and just check the list once. And you have to, during the exam, you have to be perfect. If I forget, examiners are very clever people. In the exam, he or she will ask questions from that area which he or she remembers well. But you have to remember most things, many things. So I will just discuss in short. Cranial nerve 1 is olfactory. Cranial nerve 1 is olfactory, related with olfaction. To test, before testing for olfaction. For testing for olfaction, you have to test bilaterally. You ask the subject himself and ask him or her to be honest, to close one nasal orifice well, and you take some non-toxic, non-irritant substance. Now, to test for cranial nerve, if you use chloroform, the subject, after he regains consciousness or even before he regains consciousness, he was sued by the family members. So, you use non-toxic, non-irritant substance for testing, and you have to close each nostril before going on to the another nostril. Okay, this is you have to do bilaterally, you can't do together. Before that, you have to exclude whether there is any obstruction. If there is like a disease you read in ENT surgery, deviated nasal septum. If the deviated nasal septum blocks one of the nasal orifices, or if there is a proliferation both sides, if there are nasal polyps, you read about polyps again in surgery. If there is any kind of obstruction due to foreign body, due to some cause like deviated nasal septum or polyps, then the olfactory nerve is fine, but the pathway is abolished, pathway is compromised, then the smell will not be there. So before that, before saying that the olfactory nerve is not working, the person is not getting any smell, you have to exclude obstruction due to any cause. For that, what is needed, you have to use a torch. So I always recommend watch, torch, maybe hammer you have still not dealt with, motor system. These things, stethoscope, these things if you keep yours, it is not compulsory, but if you keep yours, then it is good. Because you are getting an easy question which you know. If you don't have the hammer, if you don't have the torch, okay, forget it. Torch is being used by someone else, so you answer some other question. This happens in the exam, commonly. So, one torch has been supplied by the department or your college, and another torch can't be found out right now. So, the person, the examiner passes on to some other question, and you find it difficult. So, bad luck. So, you try to carry, that is my suggestion, try to carry these common things. Wristwatch, pulse, torch. So, olfactory nerve, you have to see the nostrils, check for the nostrils, check for exclude obstruction, and then test for smell by common substances. Okay, written, you will find the names of the substance in the books, but you have to utter. If usually olfactory nerve is so easy to test that it is not given, but still if it is given, if you make these mistakes, if you miss mistakes in basic things, it is a very bad impression. Okay? If you make mistakes in basic things, so read the book, it is very easy to do. You try, perform once or twice with imaginary substances even, but you perform the procedure even with imaginary substances. So what is needed? Torch is needed to exclude obstruction, and then we take some non-toxic, non-irritant substance so that the person does not feel discomfort. This is what is done in olfactory, very easy. Even there is nothing to show. If such substances are supplied during the exam, then only you will be asked to test, otherwise you will be asked verbally, and you mention these points that we have to check for obstruction first, we have to take the help of a torch and then we will proceed, and then we will come to our inference or conclusion, inference, that whether it is working, and you have to test bilaterally by asking the person to be honestly, or you can do it with your own finger also, without much pressure, so that the person does not feel it painful. Otherwise, the person will be doing it himself or herself. This is olfactory. Optic is actually long. We took a long time to discuss introduction. And for these types of, for cranial nerves classes, for say motor system classes, you come as early as possible. Motor system, reflexes, cranial nerves, you come as early as possible. 3, 4, 6 even may cross 2 hours if I am taking the class. Because I try to discuss relevant things as well. Like I may not have mentioned this thing, these coagulation factors. So I try so that it is helpful for you. So 3, 4, 6 try to be on time. Every class you try to be on time. Actually class is up to 10:50, you should come by 11. 10 to 10:50, written in your routine. We have made it like that so that the classes can be on time. Some practical subjects are so lengthy. So olfactory, you read it from your book, we revise again. Again next Thursday we may revise 1, 2, 3, 4, 6. If you attend on Monday 3, 4, 6, we can do 1, 2, 3, 4, 6 together again, but it will take, say, almost the whole up to 1 p.m. And in the other batch, in the last batch, I think sometimes I was requesting the students to stay up to 1:15, but some students were getting irritated, they even complained about me to the dean. Fortunately, who is known to me. So it was sorted out peacefully. Otherwise these days, we can't believe anybody. Very sorry to say. Okay, I am joking, but I could have landed at the hospital also. They রেগে গিয়ে রাত্রিবেলা মুখোশ করে এসে মেরে দিল। So it was sorted out peacefully. I did it for the sake of the students. Because our times it was 30 minutes lunch. Yesterday I scolded you for that. When it is my class, be by 1:55 within there. We could have completed yesterday's topic. ছিলে সবাই কালকে এরা সবাই থিওরি ক্লাসে we could have completed true hermaphroditism and pseudo hermaphroditism and passed on to next topic is puberty. Yesterday's topic was sex differentiation and then we have left only true hermaphroditism, pseudo hermaphroditism, effects of removal of gonads. These three, it will take 10 maximum 15 more minutes and passed on to puberty on the next class, but I'll have to complete this next class and pass on to puberty. And I'll have to see so that it is completed by the next class, next Wednesday, because we don't have much time to waste. So be by 1:55. It is very disturbing. Those biometric machines sounding and all, it is disturbing. So if you start entering up to 2:15, it is not allowed after 5 minutes past 2, but I would recommend you be there by 1:55. Sometimes I may be late, we may be late. Ion search checked, had to see over 100 patients yesterday there because I attended the class. I did from 10 to 1 p.m., 1:15. I had to see almost 50-60 patients. Still after that, I had to see 100 patients, over 100 patients. Because I had to take my lunch and go to the class. So sometimes due to these reasons, we have so many several responsibilities. So I may be late, but you don't be late. 1 hour is more than enough. 30 minutes, 40 minutes should be sufficient. Okay, I understand you have to go back to the hostel, boys hostel. You have to go back to the canteen and take still in our times also this. Canteen is at one place, anatomy, dissection is at one place, theory class, lecture theatre is at one place. I was a student of Arjika Medical College. But still, we have to manage within 30 minutes and go for the class. 12:30 to 1 was the lunch break. After lunch, so 12 to 12:30. 12:30 to 2:30 was anatomy dissection, and 2:30 to 4:30 was practicals, anatomy or physiology or biochemistry. And maybe this 5-10 minutes buffer was not given in the routine, but those were 2:30 maximum 2:40, 12:30, 12:35. We have to do it like that. You are given 1 hour, so by 1:55 you should be there. And people have become speedy, like speed should have increased. You are belonging, you are born, I think, after 2003, 4, 5, like this. Date of birth. So you are belonging to rocket age. We were lazy people on an average. At least I was lazy. I am just mentioning the points. It's most important in, so you have to check for color, field of vision, color vision. Field of vision is by perimetry. So acuity of vision. What is acuity of vision? How clearly we can see the things. Acuity of vision, field of vision, color vision in optic nerve. And you have to read what is visual angle. If visual angle subtended by two separate items is less than 1 minute, we cannot see it separately. That is what is the concept of visual angle. You read, again I recommend that particular book, I would recommend, there is no hard and fast rule. You read whatever books you have got in your hand, but I would recommend you take that book at least if you have, okay, or take from the library. You can find these things. You can be asked during the exam also, what is visual angle, what is the concept of visual angle. It is mathematically expressed by size of the object, by size of the I do have your books right now with you. Visual angle is that is mathematical expression. Size of the object by distance of the object from the eyes. That is the mathematical expression. But visual angle concept is if two separate substances, if they subtend at the eye, again you have to test both eyes separately for far vision or near vision, visual acuity. Obviously you can't for. So who have elderly people at home, if you have taken them for an eye test, you can see this chart. This is called the Snellen's chart after the name of the scientist. This is placed at a distance and the subject is asked to read out. Okay, if you have taken your parents or grandparents for these things, parents or maybe yourselves, so many people are using spectacles, this chart is read out, asked to read out. So, visual angle is if two separate things, very tiny things are there, but if the person's eye is good enough to see that from, that is what is the purpose of visual acuity measurement. If I can see even clearly from that distance those objects, but if they subtend angle less than 1 minute, so what are the units here? Degree, minute, second, like mathematics, geometry. So 1 degree is 60 minutes, 1 minute is 60 seconds, and if the angle subtended by the two separate objects, the difference is less than 1 minute, we cannot visualize those as two separate things. We find that we will see it as a single thing, and according to the color and all. So if you see it as a single thing, the color which is more prominent, according to color vision, signs of color vision, we will notice that substance only and not the other substance. Two separate lines, two separate objects, anything. So object, so two things to consider: object. Subject is yourself, the human being, and object is the object which you are looking at. That is, even you are looking at me now, I am looking at you, one of you. So and it is binocular vision. When I am seeing him, I cannot see her. Binocular vision. So if it was uniocular vision, it would be better. I can see two together roaming on the roads. I can see two people together. It would be better, right? It would be better. Yes, it would be better. During the puja holidays, whatever I am aiming to see, if I can see two together, it can be better. No, but that is not possible. Binocular vision. Binocular vision. So two eyes will see the same thing. Okay, that is one characteristic. Theory will be discussed. Vision will take 2 or 3 classes in theory. Audition, vision, CNS. CNS has not a CNS special senses towards the end of the course. Not in second internal assessment, in third, before third internal assessment, between second and third. usually taught by the HOD in the last few years, so last few classes, but this time he is retiring in April, so you have to cope with us, the rest, maybe me. Very difficult. That is itself very difficult, right? So visual angle, and these things I think practical should be done after the theory, but it is always not possible. So that is visual angle concept. We take visual acuity, field of vision, color vision, and last point is ophthalmoscopy. So ophthalmoscopy not in your syllabus. You know only the name of the instrument, ophthalmoscope, examination of the retina and all by the examination of the fundus actually. Fundus of the eye by the ophthalmoscope. Again, eye anatomy, whatever you have in the first year you have to read. Again you have to read in third year or second year onwards when there will be classes on the eye, fundus, examination of fundus, that is not in your syllabus. Field of vision, these 4 points, visual acuity, field of vision, color vision, and ophthalmoscopy. Ophthalmoscopy you don't have. Field of vision by perimetry you have in your syllabus. Perimetry will be a separate class. Perimetry will be a separate class. So for now we discuss visual acuity and color vision. Color vision is by Ishihara charts. You were tested before you entered this MBBS through these charts, and it may be also through just read the rules. These are things to memorize: edges, green lantern rule, different rules of different colored balls. Nothing to, very easy things, nothing to discuss, but you have to remember, you have to tackle MCQs and auspices. In the auspices, if it is, the picture is given, what is this? The rules of different colors. When this was not available, Japanese scientist Ishihara, when this was not invented, rules, then red green lantern test for train drivers, only red green to differentiate between. So someone is being applying for a position of he has been trained. Now before passing, he or she is going to the finally being selected for the job, that test. He has been trained for the technicalities of how to operate inside the engine of a train, or how to operate as a motorman. But finally he has to test whether the red green, even it may be tested before taking him for training, whatever, but that is for only the red green and different colors rules. So you find these terms in the books, and this is the Ishihara chart. When things, or if someone is illiterate, he cannot use the Ishihara or Snellen or designations. So for the color vision part, there will be say one circle is within another circle. Here it is written 49, here it is 87 or 37, 97. So instead of these things, there will be, if the person is illiterate, then there will be symbols of different sizes. For testing visual acuity, Snellen chart and designations chart, there is no alternative. In Ishihara's chart, instead of numbers, there may be symbols, or there may be rectangle, circle, some structure in Ishihara chart for testing color vision. But in case of Snellen's chart, there is sometimes, I don't know, I have not seen, but if it is a circle, if it is a rectangle, it can be. What you can see, circle above, rectangle before that. So one illiterate person will identify this as a circle. So like that it can be framed, but I have not seen. I have seen people reading it out, either in the hospitals or during our student life, whatever. I have seen people are asked to read out the letters. Available in English, Bengali, Hindi in your country, but English, Bengali, Hindi in our state, if you think of the whole country in English and Hindi and all, there is no national language. Do you know this? There is no national language, but usually in South they will not communicate in Hindi also. Just my friend visited Bangalore due to his daughter's illness few days ago. So they are speaking mostly Kannada or Telugu. But fortunately there were some Bengali students over there. Otherwise they had to go without food like this, or use only dry food. So they visited the Bengali students from the second onwards. First day they found it very difficult. They visited a hospital where there are doctors from different parts. Even this is happening. So try to learn Bengali when you will communicate well. Even this thing happened, that they were told, my friend is himself a doctor, but they were told, we will communicate you with that doctor who at least knows English and Hindi, because few locals are there who will say, I have, but that is not good. he or she has become a medical professional but knows only Kannada, that is not good. Or not very fluent in English. So English, Hindi, Bengali, we try to pick up all languages when you communicate here. Mostly people from these adjoining rural areas will be Bengali people. So whoever still cannot, please try. What's your name? Vizai? You are from UP, Uttar Pradesh, Jharkhand. Okay. So try to get acquainted. You have to speak, even you have to speak, because if you can't speak, the person who is coming for treatment, for consultation can't understand. So they can't be blamed. We have to, this is also a part of our training, mixing with the friends you learn. So visual acuity for near vision, today those who did not attend the class, again read the book. I'll again discuss next Thursday along with 346. But this is the Jaeger's chart for near vision. Snellen's chart, principal points are, it is kept at a distance of 6 meters, not 6 feet. So here it is written, see the lowest line is written as 6, sometimes there is another additional line written as 5. So these numbers denote meters, 60 meters, not feet. So in the British, I have seen some British, they are available on the internet. So instead of 6, they are writing 20 because 6 meters is almost more or less 20 feet. So they are measuring in feet. Here we are doing it in meters. So 6 meters. Some subject is asked to sit at a distance of 6 meters and asked to read out. How many lines can read out? That is seen. If he can read, he or she can read up to the 4th line, but not the 5th line, then it is 6 by 24. What is written over here? 6 by 24. We mention it as 6 by 24. We mention it like this. So the numerator denotes at what distance the person is seated. Do you get it? When we write the vision as 6 by 24, numerator denotes at what distance the person is seated. Denominator denotes this number which is written over here. If you can read all the lines, it is 6 by 6 normal vision. That means visual acuity is normal. Even another line is there. If it is 6 by 5. So what does 6 by 24 is? If you can read only one line, it is 6 by 60. What does 6 by 60 denote? That this can be read out by a person with normal vision. That is 6 by 6 vision can read this letter from 60 meters. But this person can read it only from 6 meters. That is the inference. Do you get it? This is the part to understand. Those who did the class, so if only one line can be read, the inference is this line which could have been read by a person with 6 by 6 vision from 60 meters, this person has to come to 6 meters to read it. This is the inference. Any problem? If it is 6 by 24, this line which is mentioning 24, XAU, these letters, all of you can read here at least, XAU can be read by the 6 by 6 person from 24 meters, but this person can read only from 6 meters and not the other lines. You read the book again, it will become clear. So I take, sometimes I do after the introductory class 1 to 4, 1 and 2 I do it another class. So we read the book, we will again discuss next Thursday. On Monday I think sir will discuss 3, 4, 6 itself, it is a long topic. So it is, hello, sorry. When the left eye is being tested, right eye will be closed, not with the fingers, but with the palm. Again, this is an important line. Because fingers, there is cheating. Okay? Palm, not possible. So, person or do it himself or herself with the palm. Now, next question is, which is important and asked in the exam from the exam point of view and done clinically. If he or she can't read from 6 meters, even one single line, then what is the procedure? We bring him or her to 5 meters. If he can read and 5 meters, when we bring him or her to 5 meters, only line which we allow him to read is, him or her to read is the last line, because there is no use. From 6 meters he couldn't read any single thing. So only thing which you have to read from 5 meters is the upper one. If he or she can, we label it as 5 by 60. Not possible at 5 meters, so bring him or her to 4 meters. And if he can positive, now it is labeled as 4 by 60. And remember, it is for a single eye at a time. So say left eye is already seen 6 by say 24. Very 80-year-old man, 70-year-old man. It is 6 by 24. 65-year-old man. It is 6 by 24. Left eye already done. Now, as we bring him forward for the right eye, not even a single can be read. So left eye, as we do it for the right eye, left eye is constantly closed. That means when we will read it out, not when he is asked to come forward with your chair or seat, then he opens again. So left eye is closed. Sorry, I was doing it for the right. So say left has been tested. So now left is closed, only right is being tested. And if unfortunate, it can be for both eyes. The both eyes is below 6 by 60. So we have to do it. So even after bringing into 1 meter, if the person cannot read anything from the Snellen chart, so it is not even 1 by 60. Maximum with the Snellen chart, it can be 1 by 60. After 1 meter, it cannot 0 meter. We cannot tell him that read from here. So it is 1 by 60. So maximum it is 1 meter. So what is done? After that, and this is very important from the exam, from OSPE for clinical exam, as the clinician we sit in front of the subject and ask him or her to, so first is, after Snellen chart is finger counting. Okay? So see the books after Snellen chart is finger counting. Finger counting. So finger counting, you remember two or three things you have to remember. So again, say I am taking an example, left eye has been tested, it is 6 by 24. Now the subject's left eye is closed and I am taking finger counting only for the right eye. If it is unfortunate, then finger counting, if for the both eyes, it has to be done for both. Again separately, but say left eye is 6 by 24, now I am testing for right eye. Even from 1 meter, he or she can read. This Snellen chart is testing for visual acuity for far vision. For near vision is the Jaeger's chart. So usually from the exam point of view, Snellen chart is asked. So after visual Snellen chart, it is finger counting. Now what we will do? The subject's right eye is closed and left eye he is looking at the clinician. Clinician is how many fingers? Say he or she will say 3. If it is correct, then finger counting is possible. Say reading the Snellen chart was not possible, but inference is finger counting is possible. But will you stop at one attempt, or will you again ask like this, or will you again ask like a different number of fingers? Will you do it, or will you stop at one attempt? One more, two more, because reason is one attempt may be done without consciously. That means just by just by assumption, he tells 3 and you think the finger counting is done. No, even he can tell 3 here, he can tell 2, 5, whatever. How many fingers? 5. So that is wrong. So by assumption, probably he or she cannot do it 4, 5 times. So you do it 4, 5 times. You understand? Already 1 PM, so I am going a bit fast, but these are easy things, but you have to remember the steps. After completing the whole syllabus, even easy things will become complicated. So finger counting you do at least thrice or 4 times, because a single attempt can be by assumption. So if you think, then that actual medical inference is wrong. If it is by assumption, he tells it 3, then you are thinking he or she is correct, but actually he did it by assumption. It may be. So you do it 4 or 5 times to confirm. If 4 or 5 times he or she is correct, then probably it is the inference that Snellen chart reading was not possible, but finger counting is possible. If finger counting is not possible, then finger counting is not possible. No. Hand movement. You move one object, usually your own hand, clinician's own hand. It is called hand movement. Any object you can do. And what do you ask? What is the question you ask? Movement hochhe ki na? So if you ask this, what he will tell? Now already the person is bored and irritated যে আমার vision is এত খারাপ যে আমি কিছুই পড়তে পারছি না, কতগুলো আঙুল গুনতে পারছি না। Do you follow it? The person is already irritated. He can't read the sentence that he or she can't count the fingers. So whatever you say, can you see my hand moving? Yes, sir. Because now you will lie. Definitely, almost definitely that yes, sir. Don't say, is there anything in front of you? What is that? What can you see in front of you? He has to say, this is the trick. Don't say, I am moving my hand. Can you see it? Answer will definitely be yes, sir, or yes, madam. Because he or she is already irritated. So, question will be, what can you see in front of your eye? If he can't see anything, he will say, something is moving. Even if he cannot say the hand is moving, sir or madam, something is moving. Or nothing. Or nothing. So, if something is moving, you write, it is written as hand movement is possible. Seeing the hand movement is possible. But actually, any object, moving object is possible to be seen. So, Snellen's chart could not be read, finger counting could not be done, but moving object, vision of moving object is possible. This is your inference. But you don't prompt that I am moving an object, I am moving an hand, I have stolen your wristwatch and moving it. No. So, I just am moving. What can you see? Please tell me. He or she has to answer. And even if this fails, then what? Then directly, you have to use the torch, obviously. You have to use the torch, project light from one side, and it is unhealthy to project directly from side. So, project. So, what can, again, I am projecting light. Can you feel? Yes, sir. So, that is not the way. What can you feel? Sir, light is falling on the eye. He or she has to tell. Remember this. And when you practice, today you can read the book. Actually it is easy. But you practice. Today you practice it on yourselves, going home. So take a torch. I think definitely torch is there with you. So try to bring it to the class also. Practice with the torch. What can you see? What can you do? Practice. All of you are, at least even with spectacles, you are normal. And these things have to be done with spectacles also. With or without spectacles. Those who are already using spectacles, so right eye for Snellen's chart with spectacles, right eye without spectacles, then left eye with spectacles, left eye without spectacles, vision has to be tested. Obviously, it will be better with the spectacles, and if spectacles have to be changed, that is what we are going for there. For testing. Why you are going for testing? For that is the reason. So finger counting not possible. This is not possible. So next is hand movement could not be seen. Now whether projection of rays. So first is perception of light. Light perception. Whether what is happening? Can you feel anything? Yes, sir, or yes, madam. Light is being projected into my eye. If that is fails, there is nothing to do. But if you have to send for the ophthalmoscopy, that fails. But if perception of light is possible, you do it from then which side? Then you tell. If perception of light is possible, then you do it from upper side and say, I am projecting the light from a particular side now. Can you tell from which side? If perception of light is possible. If not possible, you send for ophthalmoscopy, which is not within the scope of your syllabus, MBBS syllabus. If perception of light also fails, Snellen's chart, everything fails, perception of hand movement, finger counting, all fails, perception of light fails, you send for ophthalmoscopy. But if that also fails, not ophthalmoscopy, they also ophthalmoscopy. But if perception of light is possible, you do it. Okay, I am doing the same thing, now from which side? And whether this is called projection of rays from a particular direction, whether that is possible, if it is possible. Usually perception of light is there, it is possible from all regions, all sides, but that again is related to field of vision. If say cannot see from upper and lower but see from right and left, you note that. These findings you have to note. So today, go and read this topic and practice among yourselves with the help of the torch. So this is today's topic.